we click on Providence, it tells us when was that pathway updated, and you can see the pathway I'm going to show you was updated on the 30th of April this year. You can also see when it was last reviewed, and you can also see when it's due for review. So any other guideline that you're going to look at, you want to be looking at when was it reviewed. You also want to say, well, who did it? Who actually reviewed it? Who was actually accredited that process? And then you want to start saying, well, where are the evidences and what's their level of evidence? Now what's interesting with the dementia pathway is they're all new. And what does U mean? Ungraded, non-intervention node, which basically means there's not a huge amount of evidence in this area for what we're doing. But at least the map of medicine has told me, based on what we know back in April 2009, that there's not actually a great deal of evidence. However, that doesn't mean we just throw it out, because actually there are a lot of experts who kind of given us their opinions about what we're doing. So when we're looking at this pathway, we can see what kinds of people have been involved in bringing this up, and you can even click on it to be able to see what they're actually saying, where that guideline is going. So let's come back to it. We've got suspected dementia, and the first step is to say, is this the right pathway? It tells you this is about making a diagnosis of Alzheimer's disease, vascular dementia, and dementia with Lewy bodies, but it's not about frontotemporal dementia, Pick's disease, or dementia due to conditions such as HIV, and it's important for us to know who is this applying to, who is it not applying to. The next step is clinical presentation. I'm not going to go through each of these boxes, but then it describes the different ways or different areas in which patients with dementia present, and in each of those boxes, so look at memory loss and you think, well, what kind of memory loss does someone with dementia have? If you click on the I button, something like this opens up and you can see what there is, and you'll see a little button there that says notes. So if a clinician wants to write a little note, a reminder about something or another, or if a consultant, for instance, is training the junior and says, I know it says this here, but actually you need to think about this, this and this, there's an opportunity there for that clinician to write something in to remind them of it. So, let's go down. History, examination, initial investigations. Now at this point here it's saying consider referral to memory assessment services. I've got this patient who's a bit forgetful and they've been attacking their husband and I'm not quite sure what do I need to do, so I click on that and it comes up with some sort of plan, something for me to think about as I'm deciding whether I should refer this patient or not, and some of the things that I might want to consider. At that point it says let's refer the patient, and you'll notice how it goes from green to blue. So we can now see, well, what does happen to that patient when they get referred to the hospital? Well, interestingly, when they do get referred, it says here, perform a non-contrast MRI scan. It's basically a specialised body scan that is being asked for them. And what's the purpose of that? Some people might, what's the point, Doc? My loved one's losing, losing their memory and things. Well, actually, it is important because we need to make a diagnosis. We need to exclude anything else that might be going on inside the head, like a tumour or cancer or something. And it's important to try and establish what type of dementia it is, because there are different treatments and different ways of dealing with it, depending on that. So that's what it's telling me, that this is what we should do. Actually, as a GP, when I've referred someone to a secondary care environment, I actually want to see that this is what's happening. If it's not, then well, why is it not happening? Why are we providing a quality service or aren't we? So there's a check and balance there. It's not just about over to you, Doc, but it's also saying, are you providing a quality service? Conversely, of course, when that patient lands on David Jolly's desk, he wants to see that the GP has also been doing what they should be doing as well. So it works both ways. And it's about not snitching on each other, but helping each other to improve the way we deliver services so that your loved one gets the best care possible. Okay, so let's just keep going down here. Consider differential diagnoses, further investigations, manage according to likely diagnosis, Alzheimer's, vascular dementia, dementia with Lewy bodies. Let's go to Alzheimer's disease. Specific presenting features, assess severity, form a coordinated treatment and care plan. So it's telling us what the evidence says about what a coordinated care plan might look like. And again, where that's come from. Let's just keep going. Go all through all this, manage comorbidities, review the patient after 4 weeks of treatment. And then this is interesting, continuous monitoring. What is that monitoring that we need to do? And it's giving us some sort of idea of what it is we should be doing. Now, okay, that might be a blue box, but actually these patients do come back to general practice again for us to look after. So that means something to me as well. So I can use that and I can start thinking, well, these are the kinds of things that I should be doing. And then secondly, when we've got trainees who come and join us, who are going off to do these dementia reviews, we can be saying to them, can you have a look at this and just make sure that you are doing it? If there's anything there that you don't understand, come to us, and if need be, go and talk to the local consultants or the local community dementia team who might be able to advise you on that. Finally, I mentioned the fact that it's not just for doctors and nurses, patients can see it as well, and it's through something called NHS Choices, www.nhs.uk, and if you are in England or in Wales, you'll be able to access this. If you slide down, you'll see something called Health Guides on the left, and when you click on that, you can see over 390 pathways, and if you type in dementia and click on that, you'll see the very same pathway that I just showed you that doctors and nurses can see. It's the same thing so that you can also see what's going on and you can be part of the loop itself. Okay, so I've talked about dementia and I've talked about the map of medicine. I'd now like to introduce you to something very new that's only just been launched called NHS Evidence. It's going to grow, it's going to become the body that provides the evidence for why we do what we do inside the NHS. It's already available both for clinicians and patients in the public, and it's called www.evidence.nhs.uk. This is what it looks like. The eye is going to be their symbol, if you like. So anything that has the eye on it, or the pupil on it, will tell you this is NHS Evidence. And I decided, well, let's just put in dementia. I wonder what it shows. And this is what it came up with. 4,806 papers. They're working on trying to bring it down a little bit. But what I was really interested in is the #1 hit was dementia, what every commissioner needs to know. I thought, how interesting. I clicked on it, and this is the document, Dementia, what every commissioner needs to know, that's been done by the Alzheimer's Society. I'm not going to steal David Rooney's thunder, so I'm not going to go into what the strategy is, but I thought it was interesting that when you go into NHS Evidence, the first link is actually the strategy itself. Finally, what's going on inside the practice, inside Haughton Thornley Medical Centres? Well, we talk about the fact that are you empowered yet? And empowerment for me is patients having access to their medical records so they can see what's going on. Those reviews that we've just heard our trainee doctor is typing in and he's feeding the system. Well, it's of no use to anybody once it's sat on the computer. It might become useful for you as a carer or as someone who works in a nursing home or a residential home, or someone in the hospital to wonder, well, what's been going on and who's been doing what. And my feeling is that if patients can access that record, or maybe perhaps one day the carer of that patient can. There's lots of issues around confidentiality and privacy, but if we put those aside for a moment and work out a way where it would be safe for a carer to look at that, then suddenly the patient can see that very same record that I have. They've already got access to the map of medicine, so they can start to see the things that we are doing, but maybe also identify some of the things that we might not be doing. There's an opportunity with something called Health Space, where they can start recording things like blood pressures, weights, what they're eating, appointments. How many appointments do patients have? And you can't quite remember it. But if you record them in Health Space will then send an automatic reminder to you, and this is free for everybody in England, to remind you about appointments and things you've got. And then the practice website, which helps to support patients to get the best from the care that's delivered locally. Thank you very much.